doing really well here, Neil, and you?
Fantastic. Today's topic, treating and avoiding morning sickness. What is the best way to treat morning sickness associated with pregnancy?
Well, as I've said so many times, the best way to treat it is to not have it or to avoid it or prevent it.
How do you avoid morning sickness?
Well, I tell you, this might seem complicated, but it works well for most women. In my experience, I have not had to ever give a patient a nose hose or IV nutrition. So what I have to say works. In the morning, crackers and juice beside the bed. Eat that or drink it, wait 10 minutes, get up, and then fix another breakfast, a bigger breakfast. Like I said, low blood sugar is a problem before 20 weeks of pregnancy because nutrition, again, going to the baby. Crackers will supply starch or long-acting sugar, as well as some fat and protein, which will serve to give you a longer level of blood sugar and eliminate or reduce the nausea.
Yeah. What is the problem with this breakfast?
Let's see here.
Or what's an example of breakfast that should not be eaten?
There you go. Thank you. We've been taught that cold cereal, skim milk, a glass of juice, a piece of toast with margarine is a good breakfast. You might as well have a Snickers bar because this is a load of carbs, which will send your blood sugar into the air and then it'll come crashing down. So, again, it's been called a heart healthy diet, but it's not good for pregnancy. You need a balanced diet.
What's the problem with this breakfast?
Well, too many carbs, and again, sugar goes too high, you get nauseated, and then you will be then you want to eat, and then you may even progress to vomiting.
What's the best breakfast to have to avoid nausea and vomiting?
Well, it is the you want to avoid having your blood sugar levels drop. So you need all three food groups, sugars, proteins, and fat, like we talked about. And again, you need to have eggs are a wonderful, wonderful food, full of protein, albumin, and fat. So again, if you want to drink milk, drink whole milk or maybe 2%. But if you have skim milk or non-fat, the fat is replaced with carbs. And again, that would be like drinking a can of Coke. So stick with the whole milk and stick with the or 2% if you really are afraid of whole milk.
Is timing important for eating?
Yes, it is really important. You want to um, get your blood sugar up and keep it up. And that's the whole goal of how to eat. So again, it's the crackers, the juice at the bedside, wait 10 minutes, get your breakfast, and then after you're done with your big breakfast, the eggs and the fruit and the toast with butter, then take your shower. But wait, put a little bit of time between eating your big breakfast and showering. You don't want to shower before you eat your big breakfast unless you want to wind up on the floor in the shower.
What should I eat for the rest of the day?
Well, eating like a diabetic is really what you should do. So that would be 6 meals, three big ones, and then three or four little ones. And usually a snack, bedtime snack, works really well. A piece of cheese, an apple or an orange, and maybe a little bit of toast or bread.
Can I take medications to control my nausea?
Yes, there are some over-the-counter medications. Unisom is that's doxylamine. That's an over-the-counter sleep aid. 12.5 milligrams, 3 or 4 times a day. And then Vitamin B6, pyridoxine, 25 milligrams, 3 or 4 times a day. Talk with your doctor.
How do I know whether I have gallbladder disease in pregnancy?
Well, you don't know for sure, but if you have nausea after 15 weeks of pregnancy, or vomiting, or right upper quadrant pain, you have to think in terms of what else is going on, and is this gallbladder disease or is it something else? You could have pancreatitis if you let your gallbladder go far enough. Right upper quadrant pain after eating. And, when you go to talk to your doctor, then you're probably going to need to get an ultrasound for your gallstones to diagnose them. And then, as long as they're in there looking at your gallbladder, pancreas, you should get an ultrasound of your pancreas.
Can I have pancreatitis during pregnancy?
Absolutely, you can have it during pregnancy. You'd rather not have it, of course, but uh, gallbladder disease is really common in pregnancy, and pancreatitis is a function of neglected gallbladder disease. So again, if you're struggling with nausea and vomiting after 15 weeks, you really need to get a hold of your doctor and get an ultrasound of your gallbladder and your pancreas.
All right, the best place to go to is worlddocallen.com and pick up Pregnancy Your Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the World Doc Allen podcast.